Hello and welcome in medicinal chemistry classes. Today we will discuss about anti-arrhythmic drugs. Okay. So what is arrhythmia? Arrhythmia means irregularity in cardiac rhythm or abnormal rhythm of heart, also known as irregular heartbeat or cardiac arrhythmia, is a group of condition where heartbeat is irregular, too slow or too fast is called as arrhythmia. Okay. So arrhythmia is two type. First is bradyarrhythmia. In this, failure of impulse generation resulting in slow heart rate or heart blockage. The result of heart blockage is result from failure of impulse to propagate normally from atrium to ventricle, usually defect in AV node or his Purkinje system. Next is trachyarrhythmia. Okay, so in trachyarrhythmia, abnormally rapid heartbeat is generated. This condition is common clinical condition or it is treated by anti-arrhythmic drug. The drug used to prevent or treat irregularity of cardiac rhythm. The causes of arrhythmia, the root causes when the normal sequence of impulse generation and propagation is disturbed. The number of factors can be cause heart to work incorrectly. The first factor is alcohol abuse, diabetes, drug abuse, excessive medication, excessive coffee consumption, smoking, mental stress, common dietary supplement, hypertension and heart disease like congestive heart failure. These all are causes or these all are causes arrhythmia. First is your alcohol abuse, diabetes, drug abuse, mental stress, excessive medicine, excessive coffee consumption, smoking, and some dietary supplements. Hypertension is also cause arrhythmia and heart disease like congestive heart failure. So this is your causes of arrhythmia. Next is symptoms of arrhythmia. The palpitation, dizziness, cardiac arrest, confusion, shortness of breath. It is the symptoms of arrhythmia. The arrhythmia may be caused by many different factors like coronary artery disease, electrolyte imbalance in blood, or changes in heart muscle, or injury from heart attack. This is also the causes of arrhythmia. Okay, so normal heart rate of rest for children age 6 to 15, the normal heart rate is 70 to 100 beats per minute. Okay, and in adult age 18 to over, the heartbeat is 60 to 100 beats per minute. Okay, next is arrhythmia pacemaker activity. It enhances automaticity or pacemaker cell or ordinary fibers result due to pathological increase in FH4 slope, accelerate pacemaker rate, or may result from current of injury. The physiology, the acetyl-CoA reduce such a pacemaker rate by decreasing phase 4 and hyperpolarization. The ventricular wall cells may also show such a pacemaker activity due to ischemia. One of the cause of the most arrhythmia, the normally impulse propagation is synchronized manner, but here one impulse enters and re-exits area of heart more than once. No need for new impulse generation. The re-entering of impulse may be automatically defined re-entry circus movement type. Next is functionally defined re-entry. It is a micro entry. This is your normal heartbeat and irregular heartbeat. Okay. Next part is your classification. So first class of antiarrhythmic drug is your sodium channel blocker. Example is quinidine, procainamide, next phenytoin. This all is your example of sodium channel blocker. Next class is your beta adrenergic blocker, and this is example of beta adrenergic blockers. Okay. Next class is your third class potassium channel blocker. Okay, and this is your potassium channel blocker example. And last class is your calcium channel blocker, and example of calcium channel blocker is here. Okay, so this is your classification. First is your sodium channel blocker, second beta adrenergic blocker, third is your potassium channel blocker, and fourth is your calcium channel blockers. Okay, so this is classification of your anti-arrhythmic drugs. First class of anti-arrhythmic drug is your sodium channel blocker. Okay, so further class, this first class is further classified into three classes based on repolarization and potency of sodium blockage. Sodium blockage. Okay, so first class, so it bind to, the first class is bind to sodium channel in open state and prevent conduction of ions. The prolonged refractoriness by blocking several types of potassium channel or delay sodium channel recovery. It also delay AV node conduction, usually in condition where sodium channel open frequently, ectopic beats, arterial tachycardia and arterial fibrillation and ventricular arrhythmia. The lowest potency for next class in class 1 subclass second, the lowest potency for sodium channel blocker inactivate state. Do not delay channel recovery. It is used in the treatment and prevention of ventricular tachycardia and fibrillation after myocardial infarction, and this is your example of second class. Third class. This is the example of our third class. It marks sodium channel blockage in open state with longest recovery time. Refractory period of AV node is increased. Marked delay in conduction. The prolonged refractoriness by blocking outward rectifying potassium channel or general reduction in excitability. It is used in life-threatening ventricular fibrillation since they have highest affinity to sodium channel involving AV node and proximal arterial fibrillation. Next class of antiarrhythmic drug is your beta blocker. The drug used are beta blockers. Example of beta blockers is your propranolol, sotalol, and etc. Suppression of adrenergically mediated activity. The propranolol is a member stabilizing effect like quinidine on heart. High doses. It is used in high doses, or it is clinical dose cardiac adrenergic block. The clinical dose antiarrhythmic effect beta block the beta 1 receptor in heart and decrease heart rate. It is also decrease in phase 4 depolarization and atomicity in SA node. Prolongation of AV node conduction by beta blockers. Next class is your antiarrhythmic drug. Next class of antiarrhythmic drug, it is your potassium channel blocker. The potassium channel blocker prolong repolarization or increase refractoriness by blocking outward potassium conductance. The drug is amiodarone ibutylide sotalol. Its prolongation of a cardiac action potential or increase ERP. Or last class of antiarrhythmic drug. In last class there are three types. First is phenylalkylamine. In that example is verapamil, dihydropyridine. Next class is your dihydropyridine. Example is nifedipine. And last class is benzothiazepine, and example is your diltiazem. Verapamil and diltiazem are used in arrhythmia. Thank you.